Hi, this is Julie Lubinsky. I'm the Associate Director for Digital for the Christopher Dana Reeve Foundation, and I'd like to welcome you all to this month's edition of Chat Live with Nurse Linda. And I'd like to tell you a little bit about Linda. She has been a leader and a provider of rehabilitation nursing for over 30 years, and she's a friend of the Christopher and Dana Reeve Foundation for close to 20. She's a moderator in our Ask a Nurse discussion where she focuses on contributing functional advice, providing the how-to on integrating various healthcare improvements into daily life, and answering your questions. And this month, we are doing a special webinar on understanding insurance, which is so kindly sponsored by Hollister. So now I'd like to turn it over to Linda. Hi, Linda.
Hi, Julie, and thank you. Welcome, everyone, to the webinar today. It's going to be a different focus today about talking about understanding insurance. And I would like to first thank the Hollister people for sponsoring our webinar today. They do a wonderful job in connecting with us and making sure that the word and the information gets out to individuals about paralysis and spinal cord injury recovery. I would also like to have a special welcome to the listeners that are caregivers who are providing excellence in all they do for their family members or people that they provide care for, because being a caregiver is invaluable for people's life experience. So welcome to everyone. We do have a special guest today. It's a friend of mine whose name is Bernadette Morrow. She works for the Christopher and Dana Reeve Foundation as Director of Information and Resource Services. So welcome, Bernadette.
Thank you, Linda.
And would you like to tell a bit about yourself, what you do, and what your resource is for people?
Certainly. And in that job title, I help write patient information. I take call questions. Injured for 27, and direction I go in with materials is questions that are asked by individuals, as well as difficulty with over my years with a spinal cord injury.
Well, thank you, Bernadette, and thanks so much for your participation today. I would like to let everyone know that neither Bernadette and I work for insurance companies. We're not representatives of any insurance company or organizations. We are both consumers of healthcare reimbursement, just as you are, but we work with individuals who have spinal cord injury and other paralysis in an attempt to help them gain the most value for their dollar. So I would like to specifically mention that the information that we have is very general. It may or may not apply to you as an individual. And the information that we provide today you might find very helpful in some different topics, but you always have to check your own insurance policy to see if that benefit is provided to you or not. So just please be aware that we're just speaking in very, very general terms today about insurance, and more from the point of view as the consumer as opposed to working for the insurance company. We do have a quick little poll to take, and we just want to ask what type of insurance do you have? You may have more than one. You'll see our poll there, and we'll just take a quick little poll to see what you have. So there are many different kinds of insurance. There's public and private are basically two of the criteria, and you will see a bunch of options there if you want to click to that. And we do have some people who are responding. So let's just give a few minutes for that. And I am going to skip over to the next slide. And we're going to talk about how insurance works. So I'll start, and Bernadette, you can join in as you feel free. So there's basically two main types of insurance. There's what's called public insurance, and then there's private insurance. Public insurance includes any kind of funding for health care that is usually run in big groups of people. So people are very familiar with Medicare, which is provided. It's a public insurance. It's provided for people ages 65 and older. If you do have any kind of disability that's been documented for 2 years, you can get Medicare disability before you're age 65, and then you're converted over at the age of 65 to the regular Medicare plan. That plan is run by the government. It's a federally funded program, so it's pretty much the same across the country. However, there are some differences depending on where you live. For example, healthcare is more costly on both coasts of our nation, and so they usually have different payment frameworks depending on what region of the country you're in. So healthcare is cheaper in the central states and in the southern states, so they usually pay a different rate than if you're on either of the coasts. But that is commensurate with the costs, so it's not like you get paid less because you are in the Midwest. They just pay less on your bill because your bill is less. So the coverage is the same coverage, it's just that the prices are different, and so that's why you will see that. Medicaid is another public program, and that one you will find that it's different across each state. Even though it's a federally mandated program, the Medicaid policies are run by individual states, so the rules are different depending on what state you're in. And the state is the one who funds those, so it can be different if you live in one state versus another state, and the benefits will be slightly different. There are other public programs. There's some special pediatric programs that are usually run by states, and then there's also military insurance programs that's more federally organized, or it's run by the military, the Department of Defense. Private insurance are people who are usually funded by a healthcare policy that they have through work, or maybe a policy that they have obtained through the healthcare marketplace or on their own accord. Usually have those policies with insurance companies. And so we do have here the results. Oh, I skipped over one, I think. Oh, the results of our poll. And I can't, oh, here's the little button. So we find that in today's case that 80% of the people listening have private insurance, and then we have some other people, 20%, who use Medicaid and Medicare. What do you think about that, Bernadette? Do you find that most people have public or private when they phone in to ask questions and find resources with you?
I actually find that we have a mix. Many people have private, and then they will have public with it. They may keep their spouse's insurance, but they've been disabled for 2 years, so they qualify for Medicaid as well. And people will utilize their benefits to the maximum to provide the least amount of gaps and holes.
Well, and I find as well, I find in the population where I deal, because my work basically centers around a city hospital, and so I find that really not that many people come into the facility that even have insurance. And so, that's usually one of the first questions: how am I going to pay for this? And so a lot of people come in, and the hospital, the social workers will help them apply for public insurance. It's usually the state Medicaid program. And then they have that insurance, it becomes retroactive to the day that they entered the hospital. So if they were in a traumatic accident, or if they're admitted because they have paralysis because of a disease, it is usually retroactive from the day that they entered the hospital. So it's kind of a nice knowledge fallback to have, to know that, because you don't have insurance, you're not going to run into a lot of problems. On the other hand, there are people who come in and they tell me right away, don't worry, I have insurance. I have insurance. It will cover everything. Well, sometimes people don't actually read their policies because, let's face it, those are boring to read. That probably won't go well with the insurance companies. But it's not usually something somebody sits down for a little lighthearted reading in the evening. And when you get into people's policies, they find that they don't have the coverage. Sometimes people think if I have private insurance, it just covers anything I need. And that's not really true. Your insurance will cover depending on the policy that you have purchased from that insurance company. So like in my place of employment, if I would become injured, I would have 2 weeks in a rehabilitation setting for a serious catastrophic injury. So if you think about spinal cord injury, that is really not a lot of time to get adjusted to injury, learn all the new functional ways of going through life, taking care of your personal health and body. That's not a lot of time to get everything all sorted out, but that is actually what there is. So it's a good idea to know what's in your health insurance policy, basic, or if you have a different policy that has more coverage, more benefits. I do want to point out something very specific for people. If you are involved in the health insurance marketplace through the Affordable Care Act, the enrollment time is coming to a close pretty soon here. So we have the general enrollment time. The last day to enroll is December 15th. But you will see on the screen there are some dates that have delays, so they're giving you a little more time to enroll. And if you've been in any of the hurricane areas, you do have a little bit of extra time. It's not a lot of time. So if you want to take advantage of the insurance through the healthcare marketplace, you need to really pay attention to some of these timing issues. There are resources if you need extra resources. There's listed now on the screen places where you can go online, you can phone, you can Facebook, you can Twitter. So there's a lot of help. Bernadette, are you having a lot of people call in to ask for help for the Affordable Care Act?
We have in years past. One of the things that we find is, and it's a plus now, is that if somebody is newly injured and they didn't have insurance in place, and they lose their job because of their injury, we're able to direct them to the marketplace because they have a change of circumstances. And the marketplace will frequently, depending on household income, pick up the entire family, and often because of a salary having been lost, people will then qualify into Medicaid for state benefits. So we now have an option and a direction we can put people that are newly injured without insurance that moves them through the system faster than we had previously.
So that's good, and that's just one small example of all this knowledge that Bernadette has about navigating through the world and adapting and finding resources. So if you do have any questions, be sure and give her office a call. You'll talk to Bernadette or a representative in her office, and it's just extremely helpful in figuring out how to navigate the world. So we thank you all for that, Bernadette. So who are the key players in insurance? Bernadette, would you like to explain who the people are you want to deal with when dealing with your insurance, be it public or private?
Well, personally, one of the things that I have found most beneficial in dealing with my insurance is that most private insurances have case managers, and it's a well-kept secret in the insurance industry. And that case manager can make a world of difference in your care. So if I get somebody who calls that has a new spinal cord injury and they have private insurance, I always ask the family, have you called your insurance company to request the case manager for catastrophic injury? Because that's for spinal cord injury or paralysis will fall. then the insurance company will assign you a private case manager that is tied to the insurance company, and they will help you navigate any the process of moving through. So as you go to search for a rehab hospital, if you find that you want to go to one outside of your state and your insurance will allow that, your case manager can help advocate for you. The plus with case managers is if you have somebody in place, whether you're newly injured or you've been injured for a number of years, but you get a private you get an insurance case manager in place before you ask for a big device, say like a power wheelchair. If you hit a glitch or an obstacle, that case manager can help you navigate, and they can help you with the appeal. But if you go for a case manager after you've been denied, they're generally not allowed to assist you. So it's always good to have a case manager. Their goal in the insurance works to have them close the case rapidly, but you can always reopen it. As a new issue develops, you can go back and ask for case management. So you're home, you're doing well, you're 5 years post-injury, but you get a pressure sore and you're not sure what to do. Go to your insurance company and ask for the case manager and for catastrophic case management, and they can help you navigate and get the equipment and the authorization for appropriate wound care.
And I will, go ahead.
No, go right ahead, Linda.
So I will say getting that case manager is extremely important. And you can call the number on the back of your card and talk to the representative, and that's the way you get that ball rolling. So you don't have to look up a special number. You don't have to go finding things. You don't have to look up in your policy, do I have a case manager? Just call the back of your card. Sometimes the representative will look up your file and they'll say, oh, we've already assigned you a case manager. So some insurance companies will be proactive with assigning the case manager. Now, I think the part that confuses a lot of people is that the hospital has case managers as well. Those case managers are working for quality within the hospital care. They communicate with your case manager, but it's the insurance case manager who can make decisions and help with that long-term care, help with hospital negotiations, help with getting the equipment and everything that you need. So you'll hear case manager listed in two separate venues. One is the person who's working with you in the hospital system, and one is for your insurance. Sometimes people don't want to talk to their insurance case manager because they think, oh, that person's working for the insurance company, which they are, but what they're doing for the insurance company is making sure that you have some quality of care, that your needs are met in regards to your policy. So you always want to be sure and call the number on the back of your card and obtain that case manager. As Bernadette was saying, this is going to be pivotal and important when you're going to file those big claims. And I see we have a person who's written in about finding how you make a claim to your insurance. Well, working with your case manager is that key piece. Generally, when you have claims made against your insurance, it goes directly from the hospital. You sign a release when you're admitted that says that the hospital may share your information with your insurance or your payer. So your bills will go directly to your insurance, and so you don't really have to file a claim. If you purchase something separately and you make that determination, you go out and you buy a wheelchair, without going through that process, then you run the risk of, not getting that paid. So have you worked with people who are trying to work backwards, like they've bought a power chair because one was advertised on TV, and then they get the bill? Have you worked with that a lot, Bernadette?
On occasions. What we strive for is to get somebody as close to their time of injury as possible, because what the information specialist team will always let people know is that if you pay out of pocket, then getting reimbursement later is next to impossible. So you can consider generally that money gone. You can try to get it reimbursed, but insurances, Voc Rehab, and other funding agencies have such clear guidelines for reimbursement and for coverage that you have to be accepted in and be received from them, and it needs to be part of your treatment plan or your life plan to get them. We always suggest to people to get something, but you really need to wait and see. You need to see what the hospital tells you you need. A wheelchair is not something you can just go out and get on your own, or that you should go out there and then you are going to pay cash anyway because it's cheaper. And by all means, if you've got that amount of experience, go ahead and do it, but be aware that it most likely will not.
Hey, it's Julie here. Just want to jump in and say we're having some issues with Bernadette's audio. She's breaking up a bit. So I'll let Linda jump back in.
Oh, thank you. We have a little survey up here. Do you work with a case manager for your care? So if you don't have one, it might be time to go ahead and get that case manager involved in your care. Even if you don't need them right now, it's just good, as Bernadette mentioned, if you try to work, if you get some equipment or you have a treatment and you didn't have that case manager and then there's some problems with the reimbursement, to bring the case manager in later, they're going to be denied access because that is an existing file on you. So you want to have your case manager at the ready. You want to be friends with your case manager from the insurance company. You want to make sure that that they know who you are and what your needs are, because they can do a lot of work for you in getting your needs met for in the future. So you want to have them on board early, and you want to be sure that they know who you are. There's another part in managing your benefits, and this is an important factor in figuring out where to go, what to do. I know in my own personal insurance that I go to my doctor. My doctor's office has a lab within their office. But I know from the experience of, the doctor says, here, go have some blood drawn. I go to the lab in the office. I have the blood drawn. My bill comes. Oh, my gosh. The doctor's office who's in my network, I pay a lower price to that doctor, a lower fee because they're in network. But the doctor's lab in that same building, in that same suite of offices, is not in network. I have to go to a different lab. So it's important to know what's in your network, what's out of your network, because it's going to make a huge financial difference. Now, I had to learn this the hard way, where I had to pay a bill for this laboratory work, this blood drawn in the wrong place. And, of course, I had no idea. I hadn't checked my benefits booklet. I don't carry it around with me 24/7 and, well, what about this and what about that? I just knew I was in the right doctor's office, so the lab would be in the right spot, right? Well, no, it wasn't, and it was a several $100 mistake that I made, but by golly, I didn't make it the second time. So I guess you live and learn. So, let me be the error of the ways, and you can learn from my egregious error that I had there. So get to know what's in network, what's out of network. Your case manager can certainly help you with this because it's kind of hard to navigate all the paperwork. Know about managing your insurance funds. So sometimes that case manager can be very valuable, because suppose you have the usual insurance policy and you have 2 weeks in an inpatient facility. That case manager can work with your insurance company and say, well, this person is in the rehab hospital. They're definitely going home. They're not going to long-term care. So can we take some of the benefits from the long care pocket of money and put it on the rehab bill. Sometimes that will work, sometimes it won't work, but it never hurts to ask. And so if you can get your case manager to work with you in moving funds around, maybe you can get a few extra weeks in the rehab center, or perhaps you can get a different piece of equipment. If there's something that's a piece of equipment that you're really interested in obtaining, but you cannot get that piece of equipment because it's not in your policy, that case manager can maybe move some of the funds around to help you get that piece of equipment. But then if the funds are taken out of another pocket, you no longer have access. So if you took that money out of your long-term care benefit and then you decide you need to go to long-term care, you will not have that benefit. The money for that is gone until the next cycle, the next year comes up, and then it is restarted again. So you have to be very careful about moving around your funds. Another thing that the insurance case manager can help you do is if you want that piece of equipment and it's not covered in your regular policy, they can work with your health care provider to provide a letter of medical necessity that they can petition the insurance or the payer to provide a separate piece of equipment. So you really want to be able to work together well with that case manager. So Bernadette, do you have a lot of experience or some experience working with letters of medical necessity? I know I've written quite a few in my life, but I'm thinking probably you've been involved in some way.
Both personally as well as professionally. And my biggest piece of advice is read your policy, find out the guidelines of what they determine medically necessary, particularly with durable medical equipment, and then make sure that your doctor, your PT, or your OT writes the letter of medical necessity specific to the insurance guidelines. A real simple example is clothing guards for your wheelchair if you're using a manual wheelchair. They are not covered to keep your clothes clean, but they will be covered as medically necessary if it's to keep your skin from going into your wheels and preventing pressure sores or shearing. So you have to follow what your policy says and what it outlines for coverage on the DME. That's just one example. And it's very important to remember your insurance policy is a contract. So it's binding unless you can negotiate it and mediate it. So to learn it and understand it prior to making a request is very important.
And that is really key. I loved your example there. And that's one of the things that the insurance case manager knows what your policy is and knows what the details of your contract are, so that, the difference in saying, well, this is to prevent skin breakdown versus to keeping my clothes clean will make a difference if they're paying for that device or if they're not paying for that special piece of equipment or special piece of therapy. I know when we have patients come back for a yearly tune-up, as we call it, and they come back, patients in a lot of insurance policy have 2 weeks of therapy they can get to kind of just assess where they are in their mobility and their ambulation, in transfers, all that sort of thing. So they have 2 weeks of therapy every year in a lot of policies where people can have some outpatient therapy, see what's going on. Is there anything that can help, maybe some exercises to build up some strength, or maybe a new piece of equipment. And so we have 2 weeks to do that. Now, if we bring somebody into the hospital for some advanced therapies, insurance will not pay for that, but they will pay for this mobility tune-up. So it doesn't really matter so much exactly what we're doing with the patient. It matters what we call what we're doing with the patient. So if we bring somebody in for a mobility tune-up, it will be covered. But if we bring them in to learn how to use an FES bike, which is mobility, that will not be paid for. So you just have to be very careful in the wording of these. And I think it's important for people to remember not to feel like they're the responsible ones. Get your healthcare providers involved in your care as well, so that they're dealing with the case manager, that they have permission to deal with them so that they can talk the language that will be the most beneficial for your payment. And always call Bernadette's office if you have any questions, because she can clue you in to what kinds of things. And so let's talk about some typically asked questions. We have a little poll here while we talk about those questions about how you feel about your insurance coverage, and you just check from 1 to 5. Do you think it's very difficult to work with your insurance, or is it pretty easy? And there's a little scale there so you can submit your answer. So Bernadette, what would be the most popular question that people call your office and ask in regards to insurance coverage?
Well, it's not popular, but it's very frustrating, is shower commode chairs that are generally not covered by insurance.
Mm-hmm.
And how to go about getting them, and is there a way to make it medically necessary? In particular, higher level who needs the support, the chest strap, and needs the tilt, the manual for a shower. Those are generally not covered. They're considered showering to be a medical necessity. For insurances have picked that up. So it's where we find that people, they commode shower, so they'll pay for the chair, but they won't pay for the component. And it's helping people figure out what portion of it their insurance will cover.
And, I find a lot of people have questions about their catheters, and that's where our friends at Hollister really come in as well, because they have representatives that you can call, or your case manager can call and get information about catheters, and, if you wanted a more advanced catheter or you find you need one, insurance has very specific rules about having documented urinary tract infections. It's kind of a moving target. Do you know what it is currently, how many UTIs you have to have before you can get a different catheter, Bernadette?
Say 2 in a year, but I'm not 100% sure if that hasn't been changed to 3. I mean, just to give some perspective, $5 a month, 6 if we were lucky. Medicare is finally, insurance has followed suit to now allow people up to, I want to say it's $240 per month, where less than 10 years ago you got 6 straight caths, and that was all you would get coverage for.
And that's been an interesting process as well. It used to be that years ago, people went home with 1 red rubber catheter or 2 and boiled them on the stove to sterilize them, and it was a lot of work. Now there's enough evidence that's out there that indicates that catheters shouldn't be maybe reused as much. I know a lot of our listeners probably reuse their catheters, and you're getting along fine. If you're not having a number of infections, sometimes it's just easier to stick with what you know the best. But nowadays, people leave the hospital and they usually get a catheter for one-time use. There are a lot of advanced catheters with no touch and pre-lubricated and lots of things that are very helpful for some people physically, but unless there's a medical necessity, people can't get those. So it's very frustrating. But if you talk to the friendly folks at Hollister, or you talk to Bernadette, or maybe you're right into the blog, we all have some different tips and ideas. Again, it's that wording and that phrasing that can help you get the catheters. As I say, the urinary tract infections are kind of a moving target that changes periodically. It was 2, it might be 3. I think it's 3 for some insurance companies now, and usually when one payer changes, it just takes a few months and then they've all changed over to the new number. So it's not at all unusual for something to be one way today and something to be another way tomorrow. So it's just always this moving target about insurance. I know a lot of people are interested in obtaining the FES bikes, the functional electrical stimulation bikes, and I know a lot of people have expressed their feelings on the blog. They're just too expensive and they can't get them. Bernadette, do you have any tips for working with insurance to get FES bikes?
I think it's going to, well, as with anything, it depends on your insurance. If your insurance excludes exercise equipment and deems the FES bike exercise, then it's going to be with great difficulty. But if your physician can document that through rehab you have had cardiovascular improvement, you've had improvement in spasticity and tone, and list a variety of physical medical necessities, then there is a chance that you will get the FES bike approved. A lot of times families will go ahead and purchase it because they're just getting continual denials. And then once they're into the denial, the appeals process, they are successful. But it's a hit and miss, and I think it's in part because of the cost. I also think it's in part because there's not a good way to manage and monitor what the patient is doing at home. So the insurance concern is that, well, we're paying all this money, but are they using it? And that's part of something that you need to find a way to document. Insurance is driven by data, and if you can show the data that you're having actual improvement and that you're actually participating and using it, then you're more likely to meet with success. But the FES bike is one of those pieces of equipment that is very difficult to get coverage for these days. And then I believe my personal opinion is it's because of the high price tag.
And I would have to agree with you definitely on that. Even when the bikes were in a different type of bike and it was just double the cost of what it is now, the prices have come down quite a bit. But even at that, we were able to get some people some bikes through letters of medical necessity. Again, as Bernadette said, it depended on if the patient was using the bike in the facility and they were showing some recoveries or some other medical benefits to doing that exercise. But the majority of the patients were not covered, and that's usually the way it is now. People really work very diligently to try to get what the evidence, the researchers of the world and the people who are really studying these things have demonstrated some wonderful benefits of having these specialty type of equipment. But unless that piece of equipment is benefiting you personally and you're demonstrating that you are using it, whenever people have gym memberships or they buy a treadmill, it's the big joke. Oh, it becomes a clothes hanger, and that's where I keep my clothes on the treadmill because, nobody sticks to those exercise plans. So it takes a real commitment to want to be able to do some of these therapies. And then there's the ongoing fees because you have to buy different electrodes to keep those up to proper use, and so there's ongoing fees with it as well. And so hopefully things will change in the future, but as right now, it's kind of difficult to get some of these higher level pieces of equipment. And I know
Linda,
that we have. Yes.
I was just going to jump in and say one way that I found people to be successful, and it's a little bit outside of the box, and it's a good tip to share, is if you're going back to school or if you're returning to employment, sometimes Voc Rehab will pay for this equipment. If you can show it will make a difference in your ability to maintain employment and to function well in classes. So I had one individual who managed to get her FES bike covered by her state Voc Rehab because it minimized and helped her spasticity so much. I've had other people get standing wheelchairs covered from Voc Rehab so that they could stand up in speech class, so that they could access the labs for their science classes that were mandatory. So there are other ways that you can think outside of the box, and again, our information specialists are knowledgeable about these ways, and they're also a good resource. So if you're stuck and not sure which direction to go in, calling the information specialist team or sending a question in through the website is a great way to find a possible answer.
And there's all kinds of things that people do. I had one individual who petitioned a wealthy person about town and developed a business plan, and part of the business plan was that he had an FES bike that would keep him healthy so that it would maintain his business. And this individual funder funded his FES bike because he could present that argument that made sense, that if you're going to start a business, we need to keep you healthy so your business keeps running. And so part of his workday included he had an office, and in his office was his FES bike. And so part of the workday he spent on his FES bike for an hour, and it was just kind of cool to see how all of that work together, and that's when insurance works well, is when things are really coming together. One other thing before we leave this topic is DME restrictive caps. Do you want to just talk a little bit about that, Bernadette, because that's so very important for people to understand?
Yes, I think it's real important for everybody to look at your plan and see what your DME cap is. And with that, it will help you plan for purchasing. There has been a huge shift in private insurance to minimize the DME coverage. But in some ways that's an improvement because many states never used to have DME coverage in their insurance. It wasn't mandatory. So now it is mandatory that every state must cover DME insurance. But with that, we've seen a shrinking of the dollar amount. So know what your benefit is, know what the cap is, and then figure out which equipment you can get elsewhere cheaper if you're going to have to pay out of pocket. Always have that prescription so that you can, if you can't take it off your insurance, you can take it off your taxes as long as you itemize and hit 10% at the end of the year. But you need to be knowledgeable about these things so that you can make wise choices on features. We are seeing more and more people fundraising for their equipment, just to get a hospital bed, to get their wheelchair, and just basic necessities. One of the things, though, is that if you spend so much out of pocket for your equipment, it may in fact qualify you into Medicaid. Keep an eye on that. Keep track of it. It's called a Medicaid spend down. get flex spending to help you cover and manage your cost or your out-of-pocket cost. But those are some of the things that you have to be aware of. Otherwise, you may end up getting a wheelchair that is just well out of range of coverage, even though it's medically necessary. But the high-end expensive wheelchairs will frequently qualify people into Medicaid, and you need to be aware of that and know what your out-of-pocket costs are so that you can apply accordingly.
So that's very important because there's all these little caveats within. So, we've talked about individual pieces of equipment, durable medical equipment when we refer to DME, but there is a restrictive cap for what that's going to be. Now, sometimes I've known people who've had one insurance policy, and when they reach their caps or get close to the caps and it comes their open enrollment time, if they have the option, they'll switch to another insurance company so that they're not up towards their caps. Have you heard of that, Bernadette?
Yeah, and for those individuals who have the ability to move within insurance plans that meet their needs and that will allow them, I think that's a good idea. But insurance has been increasing in cost, and people are having difficulty. The list of insurances are shrinking down for many people, so that is key in terms of switching between policies. But I've known a number of people that have done it, and I have on more than one occasion when somebody was newly injured, I have suggested to the family and to look at when their open enrollment was and to switch plans as soon as their open enrollment happened so that they would in fact have better coverage for their family member.
And that's really taking the initiative, because that is a lot of work to understand what's in the insurance policies, to know where you are within your insurance policy. It takes a lot of effort to be able to do all these kind of fancy things with your insurance. It just is a real challenge every single day, but so necessary when you're in one of these situations where you're depending on so many people to help you. So be sure and take advantage of that insurance case manager. It's going to be very critically important to you so that you can maintain what you need to do. And, there are many times when insurance works well. There are many times when you can obtain benefits, when people are working with you, when they're looking out for you. Sometimes your insurance case manager will even call you and say, there's this new thing, or what do you think about this? Or I know from problems that you've been having, maybe this particular treatment will help you. And so they'll recommend some things. So, you don't always have to be the one initiating. Sometimes they will initiate with you as well. You just want to stay closely connected to them, because whenever you make an appeal or you apply for a certain benefit, the person who is the holder of the insurance contract will be notified if the benefit has been accepted or rejected. So if you are a child, or if you're under your parents' insurance policy, that letter of acceptance or denial is going to go to the person whose name is on that insurance policy. So in my circumstance, I'm the person who has insurance through their work, so my husband is covered through my insurance policy. A lot of families make that decision. Instead of carrying two different policies, you just get one policy through one person's work. And in my family, it's through my work. And so if my husband should want something or have an appeal, or if he should be doing something within the insurance, that letter of acceptance or denial will come to me, not to him, and not to the case manager, and not to your health care provider. Well, the insurance case manager will be aware because they work for that company. but it will not go to the doctor that ordered the equipment. It will not go to the person requesting it. It goes to the owner of the policy. So you have to keep all your players in line knowing what's going on. So if a letter of denial will come, it will usually say within the letter, you have this many days to appeal this. So if you do not appeal within that time frame, that case is then closed. So that item is now over. That's finished. So you want to be sure and get that letter of denial to your health care provider, talk to your insurance case manager, find out what you should be doing next, and just keep in contact with everyone as often and as frequently as reasonable. You don't want to call up somebody every hour, but if you're working on something, you want to make sure you stay in close contact with that person. If we have any questions, please feel free to write in any questions, but we are coming to the end of the hour. So remember, if you do have any questions that come up, you can always write into the blog at any time. And you can certainly contact Bernadette's office at any time if you have any questions that you think you would like to get some answers from her. And Bernadette, do you want to repeat your contact information?
Sure. You can call the Christopher and Dana Reeve Paralysis Resource Center. And let's see, I believe I have the old 800 number listed. I apologize. You can reach through at 800-539-7309, or you can come through our web on the Ask a Question, and that is at christopherreeve.org/ Julie, help me here. Is it Ask a Question?
ChristopherReeve.org/ask. I posted in the chat box.
Yes.
Perfect. Any other words of wisdom, Bernadette? Anything that you can think of that people really need to concentrate about with their insurance?
Well, I think there's one last tip, and that's keep an open door in communication with your human resource department, who helps get coverage for your private policy. If you talk to them, you let them know what obstacles you're hitting. Often they can reach out to the broker and or the insurance company and see what they can do. It's something to keep in mind. And number two is your case manager can make or break whatever you need. So it's fine to have disagreements, but I urge people to be polite, courteous, while standing firm on what they need for themselves or their family member, because they can be your best friend or they can be your worst friend. And I have to say I've been very fortunate, and I've had many be very, very strong advocates for me. So I can't recommend them enough. But in the frustration of a new injury or not being able to get wheelchair or equipment, it is so easy to get upset. And try to take a deep breath, step back, and remember that this person's going to help you for the long course.
And those are very good words of wisdom, because I know sometimes, well, let's be just frank, sometimes people are so frustrated with their situation, and, you think you've been paying insurance, so you think everything's going to be covered. You've gone through a catastrophic event. You find out that things are not covered the way that you had imagined that they would be. And next thing you know, you've got somebody who's swearing at the case manager, not taken very favorably, so you want to be very kind and cordial to these people, because they really are there to help you. Their goal is to be able to meet your needs. Yes, they're interested in working. They work for the insurance company, but their goal is to make sure that you have less complications, which reduces their payment. So the quality is really what they're focusing on, as opposed to the money, making sure that you lead a healthy and productive life. So we're at the top of the hour, so I would very much like to thank Bernadette for her participation in the webinar today. It was a lot of fun, and the knowledge that Bernadette has is just outstanding. As a consumer and as a user of health insurance, it was just a delight having you here today. And I'd also like to thank again the Hollister people for sponsoring our webinar today. It's always welcome to have them with us in some way, and then also to thank the caregivers of the world who are doing such a heroic job and taking such good care of our constituents in the Reeve Foundation. So thank you everyone for joining us today. Please remember, if you have any questions, to write into the blog, and it was lovely chatting with you today. Thanks so much, Bernadette and Julie.
Thank you, Linda. Take care. Everybody have a great day. Bye.
Bye.
Thank you. Thanks for joining us, and this is recorded, and it will be on our YouTube channel by the beginning of next week. Thanks, everybody. Have a good day.
Thanks.
Ladies and gentlemen, this does conclude today's conference. We thank you for your participation. You may now disconnect.